what we've seen is that if you define people by where they live and define where they live according to an index of multiple deprivation, you see a social gradient. The more the deprivation, the higher the mortality, the shorter the life expectancy. Over the last 12, 13 years, what we've seen is those inequalities have got bigger, but the degree to which they've got bigger depends on which region of the country you're in. If you're in the northwest, like Cheshire and Merseyside, or the northeast, Newcastle, north of Tyne, and the like, the consequence of living in an area of deprivation for your health is much bigger. So in other words, if you're in the least deprived 10% in Liverpool, Newcastle, London, the life expectancy is not very different. If you're in the most deprived 10%, from the point of view of your health, you're far worse off to be in Cheshire or Merseyside or in the northeast than in London. And the health for those people in the most deprived areas has gone down over the last decade. So we've seen 3 bits. Improvement in life expectancy overall has slowed. Second, increase in inequality. Third, life expectancy for the poorest people's got worse. What if everybody with a level of deprivation greater than the best of 10%, what if everybody below the top 10% had the low mortality of the top 10%? So in other words, it's not focusing on how bad it is at the bottom, but how good it is at the top. And what if everybody enjoyed that good health? In the decade after 2010, there would have been 1 million fewer deaths. Now, there was always a social gradient in health, but the gradient got steeper. And we calculated that there was probably something like 146,000 extra deaths linked to deprivation in the decade from 2010 on. Arguably, that's the result of austerity. There's a prima facie case that austerity killed 146,000 people linked to deprivation. Wow.